And we are back. Gynecomastia is a common disorder that affects the size of the breast tissue in males. In fact, up to 70% of adolescent boys experience this during puberty. Here to tell us all we need to know is board-certified plastic surgeon, Dr. Babak Dadvand. Hi, Dr. Dadvand, how are you?
Hi, Eraldo. Nice to meet you.
Well, nice to meet you. Thanks for being here.
Thanks for having me.
So, tell me about what is gynecomastia.
Well, quite simply, gynecomastia, it comes from the Greek terms gyne and mastia, which basically just means feminine breast. And so in a man, it just means that they have an enlarged breast, and it can happen for a lot of different reasons, and they come in all different shapes and sizes.
So I noticed when I was about 13 that I believe I had that issue, and the way that I was able to rectify it is by exercising. Is that something that can help with the treatment of this issue? Or? So
the first part of that you mentioned is absolutely correct. It's called physiologic gynecomastia. And one of the most common times in a guy's life to get gynecomastia is during puberty. In some studies, like you'd mentioned, 60 to 70% of boys going through puberty get some form of gynecomastia. And it's because there's so many hormone imbalances that are going on at that time. And so typically the rule of thumb is, though, in a huge majority of these patients, 97, 98%, it goes away after 2 to 3 years. So I see a lot of teenagers in my office, and the first thing I ask them is, how long have you had it? If it's less than 3 years, I don't operate on them, because for the most part, it's going to go away. So probably that's more likely that what happened in your case, not so much the exercise, but just that your body kind of grew out of it, so to speak.
So what are some of the symptoms that you need to be aware of?
Yeah, so, gynecomastia can present with severe pain. That's probably the most debilitating, and that's sometimes the first thing that guys feel. They feel this tingling or this real sensation or pain. It can be pretty debilitating too, and some guys, they can't even do their daily activities, they can't even get a big hug. But then there's a whole nother spectrum of guys that have no symptoms at all, no physical symptoms. But the issue is not so much the physical symptoms in these guys, it's the emotional and the psychological symptoms. It really affects their self-esteem, it affects their self-confidence, their ability to do things that they normally do. And I'm from Los Angeles, so when you have the pool and the beach and you can't go and take your shirt off, you take for granted having a normal chest.
Of course, and I know I mentioned exercising, but does that resolve some of the issue maybe?
Yeah, so for true gynecomastia, and true gynecomastia means having excess breast tissue. So the male chest has breast tissue and fatty tissue, and we all have both. But when you have too much excess breast tissue, that's true gynecomastia. Some guys have too much fatty tissue, which is technically can be better with exercise, because just like you lose weight, you'll lose fat in the chest as well. But if you have excess breast tissue, there's no amount of exercise that necessarily makes the fat or the breast tissue dissolve or melt away. Are there any surgical procedures to remove this? So that's where I've kind of carved out my specialty, is the treatment of this surgically. And if you have true gynecomastia, meaning excess breast tissue, surgery is really the only predictable way of treating it. And it's done in an outpatient procedure under either local or general anesthesia, and you remove most of that breast tissue to reestablish that natural contour. And the good thing about gynecomastia surgery is that it's permanent. It doesn't come back unless the person does something to re-stimulate the breast tissue, whether it's taking steroids or doing something else that'll stimulate whatever remaining breast tissue that might be left in behind. Because the goal of the surgery is not necessarily to take out all the breast tissue, just enough to give a normal contour.
Right, so I guess my next question, are there certain foods that cause this maybe, or certain, I know you mentioned, steroids, and that affects a lot of the parts here, but are there certain foods maybe that we should be staying away from? Or?
Eraldo, that's a great question, especially coming from someone who's a fitness expert like yourself. Well, diet is very important. Now, there have been some reports about, say, soy products, and really, there's nothing definitive as far as any specific food that can cause gynecomastia. The one report that had soy as a cause was a gentleman who was consuming huge amounts of soy milk a day, something that's far beyond what a normal person would be taking on a regular basis. So I would say no, food is not really one of the main causes of gynecomastia, but there is a whole list of other things that can cause gynecomastia.
Wow. And it's, it's becoming more and more evident, right? In people that you see in your office, it's becoming more and more, right? You see it more?
I say the statistics out there show that between 20 and 30% of males throughout part of their life experience some form of gynecomastia, and teenagers especially during puberty, 60, 70% do. So it is probably the most common unspoken issue in plastic surgery, and especially in male plastic surgery.
Wow. Well, that's a great. Thank you. Thank you so much for being on the show and exploring this this issue that a lot of these young gentlemen are having. So thank you for coming on. I really appreciate it.
Thank you for having me, Eraldo.
All right, no problem. All right, and thanks again to all of my guests for being here today, and thanks to all of you at home for watching. Make sure you tune in next time for another great show. And remember, take care of your body today, and it will take care of you. I'll see you next time.